Jaundice. Jaundice is a yellow color of the skin, mucous membranes, or eyes. The yellow coloring comes from bilirubin, a byproduct of old red blood cells. Jaundice can be a symptom of several health problems. Jaundice has many causes, including hepatitis, gallstones and tumors. Newborn babies often get it. Infant jaundice is yellow discoloration of a newborn baby's skin and eyes. Infant jaundice occurs because the baby's blood contains an excess of bilirubin, a yellow pigment of red blood cells. Infant jaundice is a common condition, particularly in babies born before 38 weeks gestation, preterm babies, and some breastfed babies. Infant jaundice usually occurs because a baby's liver isn't mature enough to get rid of bilirubin in the bloodstream. In some babies, an underlying disease may cause infant jaundice. Most infants born between 35 weeks gestation and full term need no treatment for jaundice. If a baby with very high levels of bilirubin is not treated, there's a risk they could develop permanent brain damage. This is known as kernicterus. In adults, jaundice itself usually isn't treated. But your doctor will treat the condition that's causing it. See a doctor right away if you think you have jaundice. It could be a symptom of a liver, blood, or gallbladder problem. Jaundice is a condition in which the skin, sclera, whites of the eyes, and mucous membranes turn yellow. Bile is fluid secreted by the liver. Bilirubin is formed from the breakdown of red blood cells. Jaundice, also known as hyperbilirubinemia, is a yellow discoloration of the body tissue resulting from the accumulation of an excess of bilirubin. Deposition of bilirubin happens only when there is an excess of bilirubin, a sign of increased production or impaired excretion. The normal serum levels of bilirubin are less than 1 mg per deciliter. However, the clinical presentation of jaundice is kernicterus, peripheral yellowing of the eye sclera, is best appreciated only when the levels reach more than 3 mg per deciliter. Sclerae have a high affinity for bilirubin due to their high elastin content. With further increase in serum bilirubin levels, the skin will progressively discolor, ranging from lemon yellow to apple green, especially if the process is long-standing. The green color is due to biliverdin. Bilirubin has two components: unconjugated, indirect, and conjugated, direct, and hence elevation of any of these can result in jaundice. Icterus acts as an essential clinical indicator for liver disease, apart from various other insults. Carotenoderma. Yellowing of skin sparing the sclerae is indicative of carotenoderma, which occurs in healthy individuals who consume excessive keratin-rich foods. Jaundice in newborn babies is common and usually harmless. It causes yellowing of the skin and the whites of the eyes. The medical term for jaundice in babies is neonatal jaundice. Yellowing of the skin can be more difficult to see in brown or black skin. It might be easier to see on the palms of the hands or the soles of the feet. Other symptoms of newborn jaundice can include dark, yellow urine. A newborn baby's urine should be colorless. Pale-colored poo, it should be yellow or orange. The symptoms of newborn jaundice usually develop 2 days after the birth and tend to get better without treatment by the time the baby is about 2 weeks old. Your baby will be examined for signs of jaundice within 72 hours of being born as part of the newborn physical examination. If your baby develops signs of jaundice after this time, speak to your midwife, health visitor or GP as soon as possible for advice. While jaundice is not usually a cause for concern, it's important to determine whether your baby needs treatment. If you're monitoring your baby's jaundice at home, it's also important to contact your midwife straight away. If your baby's symptoms quickly get worse or they become very reluctant to feed. Why does my baby have jaundice? Jaundice is caused by the buildup of bilirubin in the blood. Bilirubin is a yellow substance produced when red blood cells, which carry oxygen around the body, are broken down. Jaundice is common in newborn babies because babies have a high number of red blood cells in their blood, which are broken down and replaced frequently. Also, a newborn baby's liver is not fully developed, so it's less effective at removing the bilirubin from the blood. By the time a baby is about 2 weeks old, their liver is more effective at processing bilirubin. so jaundice often corrects itself by this age without causing any harm. In a small number of cases, jaundice can be the sign of an underlying health condition. This is often the case if jaundice develops shortly after birth, within the first 24 hours. Other causes. An underlying disorder may cause infant jaundice. In these cases, jaundice often appears much earlier or much later than does the more common form of infant jaundice. Causes. Diseases or conditions that can cause jaundice include internal bleeding, hemorrhage, an infection in your baby's blood, sepsis, other viral or bacterial infections, an incompatibility between the mother's blood and the baby's blood, a liver malfunction, biliary atresia, a condition in which the baby's bile ducts are blocked or scarred, an enzyme deficiency, an abnormality of your baby's red blood cells that causes them to break down rapidly. How common is newborn jaundice? Jaundice is one of the most common conditions that can affect newborn babies. It's estimated 6 out of every 10 babies develop jaundice, including 8 out of 10 babies born prematurely before the 37th week of pregnancy. But only around 1 in 20 babies has a blood bilirubin level high enough to need treatment. For reasons that are unclear, breastfeeding increases a baby's risk of developing jaundice, which can often persist for a month or longer. But in most cases, the benefits of breastfeeding far outweigh any risks associated with jaundice. Risk factors. Major risk factors for jaundice, particularly severe jaundice that can cause complications, include premature birth. A baby born before 38 weeks of gestation may not be able to process bilirubin as quickly as full-term babies do. Premature babies also may feed less and have fewer bowel movements, resulting in less bilirubin eliminated through stoolie. Significant bruising during birth. Newborns who become bruised during delivery gets bruises from the delivery. May have higher levels of bilirubin from the breakdown of more red blood cells. Blood type, if the mother's blood type is different from her baby's. The baby may have received antibodies through the placenta that cause abnormally rapid breakdown of red blood cells. Breastfeeding, breastfed babies, particularly those who have difficulty nursing or getting enough nutrition from breastfeeding, are at higher risk of jaundice. Dehydration or a local uric intake may contribute to the onset of jaundice. However, because of the benefits of breastfeeding, experts still recommend it. It's important to make sure your baby gets enough to eat and is adequately hydrated. Race. Studies show that babies of East Asian ancestry have an increased risk of developing jaundice. Complications of jaundice. High levels of bilirubin that cause severe jaundice can result in serious complications if not treated. Acute bilirubin encephalopathy. Bilirubin is toxic to cells of the brain. If a baby has severe jaundice, there's a risk of bilirubin passing into the brain, a condition called acute bilirubin encephalopathy. Prompt treatment may prevent significant lasting damage. Signs of acute bilirubin encephalopathy in a baby with jaundice include listlessness, difficulty waking, high-pitched crying, poor sucking or feeding, backward arching of the neck and body, fever, kernicterus. Kernicterus is the syndrome that occurs if acute bilirubin encephalopathy causes permanent damage to the brain. Kernicterus may result in involuntary and uncontrolled movements, athetoid cerebral palsy, permanent upward gaze, hearing loss, improper development of tooth enamel. Prevention of jaundice. The best preventive of infant jaundice is adequate feeding. Breastfed infants should have 8 to 12 feedings a day for the first several days of life. Formula-fed infants usually should have 1 to 2 ounces, about 30 to 60 milliliters, of formula every 2 to 3 hours for the first week. Treating newborn jaundice. Treatment for newborn jaundice is not usually needed because the symptoms normally pass within 10 to 14 days, although they can occasionally last longer. Treatment is usually only recommended if tests show very high levels of bilirubin in a baby's blood. This is because there's a small risk that bilirubin could pass into the brain and cause brain damage. There are two main treatments that can be carried out in hospital to quickly reduce your baby's bilirubin levels. Phototherapy, a special type of light shines on the skin, which alters the bilirubin into a form that can be more easily broken down by the liver. An exchange transfusion, where your baby's blood is removed using a thin tube, catheter, placed in their blood vessels and replaced with blood from a matching donor. Most babies respond well to treatment and can leave hospital after a few days. What causes jaundice in adults? Jaundice happens when there's too much bilirubin, a yellow-orange substance, in your blood. It's found in your red blood cells. When those cells die, the liver filters it from the bloodstream. But if something's wrong and your liver can't keep up, bilirubin builds up and can cause your skin to look yellow. 3 phases of bilirubin. Jaundice can be caused by a problem in any of the 3 phases in bilirubin production. Before the production of bilirubin, you may have what's called unconjugated jaundice due to increased levels of bilirubin caused by reabsorption of a large hematoma, a collection of clotted or partially clotted blood under the skin. Hemolytic anemias, blood cells are destroyed and removed from the bloodstream before their normal lifespan is over. During production of bilirubin, jaundice can be caused by viruses, including hepatitis A, chronic hepatitis B and C, and Epstein-Barr virus infection, infectious mononucleosis. Autoimmune disorders. Rare genetic metabolic defects. Medicines, including acetaminophen toxicity, penicillins, oral contraceptives, chlorpromazine, thorazine, and estrogenic or anabolic steroids. After bilirubin is produced, jaundice may be caused by obstruction, blockage, of the bile ducts from gallstones, inflammation, swelling, of the gallbladder, gallbladder cancer, pancreatic tumor. Symptoms of jaundice. Jaundice may appear suddenly or develop slowly over time. Symptoms of jaundice commonly include yellow skin and the white part of the eyes, sclera. When jaundice is more severe, these areas may look brown. Yellow color inside the mouth. Dark or brown colored urine. Pale or clay-colored stools. Itching, pruritus, usually occurs with jaundice. Note, if your skin is yellow and the whites of your eyes are not yellow, you may not have jaundice. Your skin can turn a yellow to orange color if you eat a lot of beta-carotene, the orange pigment in carrots. Other symptoms depend on the disorder causing the jaundice. Cancers may produce no symptoms, or there may be fatigue, weight loss, or other symptoms. Hepatitis may produce nausea, vomiting, fatigue, or other symptoms. How is jaundice diagnosed? Doctors diagnose jaundice by checking for signs of liver disease such as bruising of the skin, spider angiomas, abnormal collection of blood vessels near the surface of the skin, palmar erythema, red coloration of the palms and fingertips. Urine test. Urinalysis, urine testing, that's positive for bilirubin shows that the patient has conjugated jaundice. The findings of urinalysis should be confirmed by serum testing. The serum testing will include a complete blood count, CBC, and bilirubin levels. Other tests may include hepatitis virus panel to look for infection of the liver, liver function tests to determine how well the liver is working, complete blood count to check for low blood count or anemia, abdominal ultrasound, abdominal CT scan, magnetic resonance cholangiopancreatography, MRCP, endoscopic retrograde cholangiopancreatography, ERCP, percutaneous transhepatic cholangiogram, PTCA, liver biopsy, cholesterol level, prothrombin. How is jaundice treated? Jaundice usually doesn't require treatment in adults, it's a more severe problem in infants. The causes and complications of jaundice can be treated. For instance, if itching is bothersome, it may be eased by cholestyramine, Questran. What are some of the complications/side effects of the treatments of jaundice? constipation, bloating, stomach pain, gas, upset stomach, vomiting, diarrhea. Can jaundice be prevented? Since there are many causes of jaundice, it's hard to provide specific prevention measures. Some general tips include: avoid hepatitis infection, stay within recommended alcohol limits, maintain a healthy weight, manage your cholesterol.